We've been engaging with people everywhere in BC and did this morning. When I was here, really at the spot in the month of June, we announced here at Surrey Memorial Hospital 30 measures. And what we wanted to discuss today, because we've made, I think, significant progress here working together, but there is a lot more work to do. We're also seeing in our healthcare system very high rates of utilization. Demand is extraordinary. Today, across BC, on a Friday at the beginning of September, in advance of respiratory illness season, we have about 9,700, a little more than 9,700 admitted patients in acute care hospitals today. At this time of year, we'd expect that to be about 9,000 in previous years. And certainly the surge in patient demand that we saw that really started at the end of COVID year 3 has continued. And so we saw throughout July and August really respiratory illness season levels of hospital patients in hospitals everywhere in BC, and you feel this everywhere. So there was no dip below 9,000 patients that often occurs in July and August. Instead, we saw 9,700, 9,600, 9,700 all through those months. So the healthcare workers who work here in Surrey and the healthcare workers that work everywhere in BC have been doing exceptional things. In August, there were weeks when we did 600 more surgeries than before the pandemic across BC hospitals, which is an extraordinary success. And it's not my success or the government's success. It reflects the work of operating room nurses and unit clerks and, of course, surgeons in that system. So we're doing more surgeries than ever before, more primary care visits than ever before, more diagnostic procedures than ever before. We have more people in hospitals than ever before in our healthcare, and we have more people working in the system than ever before. And that demand is the new normal, and we have to work to address it. Of course, we'll have more to say next week about the second hospital. Looking forward to that discussion, and that's great news for the people of Surrey as well. The Progressive Intercultural Society is tendering on long-term care in Surrey and all of the other things that we're adding, and especially in primary care, to support healthcare in Surrey. But as I say, we stood here 3 months ago. Today is a report card of where we are. We had an opportunity to meet with doctors, I think, this morning, and other health professionals in discussing this, and their approach was, of course, positive, but they're also dealing with what has been an extraordinary and unprecedented summer of activity in our healthcare system, one that we expect to continue through respiratory illness season.